The regional chairman, Mr. David Armagon, announced that the number of COVID-19 cases in Region 6 has increased to a total of 59 actives. More in this report by Jalissa Hines.
59 active cases as I speak. Just because we're not showing all these figures, people are not aware. We are after region 4 that has just over 100 cases. And so between we and Region 4, we account for about 92% of all cases in the country. Right? Because it's just about 200 odd cases, active cases. In the country, it's just about 200 something active cases. There has not been any deaths recorded for the last couple of weeks. I think 4 persons are in the ICU. 4 persons are in the ICU. For a long time, nobody was in the ICU. The persons begin to go back, and now beginning to go back into the ICU. So it is not that all is well, and it's not that we should relax our measures.
That was Region 6 Regional Chairman Mr. David Armagon disclosing the increase in active COVID-19 cases in the region at the Regional Democratic Council's monthly statutory meeting held yesterday at the Council's boardroom. The chairman went on to disclose.
The thing is, yes, government has relaxed some of the measures for obvious reasons, because at that time the situation had abated somewhat, and we used to get just 2 to 5 cases per day. But as the minister explained at his last press briefing, the numbers are beginning to increase again. And so we need to wear our mask in public and to do our sanitizing, make sure that we are sanitizing, and to make sure that we keep our social distancing. Because it's important, from the numbers we are seeing, based on what the minister is saying, he's expecting this number to go up. And Cumberland has quite a lot too. Within the Cumberland area, you probably got about 15 there, and it stretches right across the region. Right? So it's not a good scenario developing here.
Regarding the COVID-19 task force and vaccination in the region, the chairman stated,
COVID-19 task force from the region, we'll try and meet back again from next week to make sure that we can coordinate back these activities, and we have so far 87% first vaccine. We have 69% second vaccine, second dose. The booster has been pretty low, just about 30%, 9 to 30%. And for the adolescent vaccine, we just about 59%. The first dose of the adolescent vaccine. So it's not all rosy, it's not all, especially now that the children are going back to school, and only 59% coverage you have, which is pretty low. And then that's the first dose. The second dose is much, much less than that. Right, so I think parents need to encourage their children to take the shots.
Mr. Armagon then highlighted the importance of the booster shot.
Now the booster shots are available. Right, you can go to any one of these centers that we have operating, and you can get your booster shot. Because after 6 months, the research has shown that the veracity or the potency of the vaccine tends to get weak.
The chairman went on to highlight other issues in the health sector in Region 6.
We had some issues too with Port Brant Hospital 2 days ago. A guy named Hanwan sent a message to me that the accident and emergency section was closed. I saw it in some of these Facebook things. But then on investigation, somebody who was in the accident and emergency section being looked after, and that is why the doctor closed the door so that everybody can't come in at the same time. Otherwise it would have disturbed the way that he's looking at it. Sometimes people make all kind of report. And let me tell you this too. There are many people, and I have seen this too, There are many people, although the inside of the accident, there is a big room there. You can go and sit down. People prefer to gang up outside and wait. And then somebody takes the picture, put it into the Facebook and gone viral. And then you hear that they got space inside here. Nobody is there.
He then disclosed these details about outreaches and complaint desks.
Number on a monthly basis now, we're going to be having outreaches to the various hospitals around the region, New Amsterdam Hospital, Portmont Hospital, Skellen and Blackbush. At least once every 2 months we'll have an outreach to these hospitals. So people who come in there, they can make complaints. It's like a complaint day. Right? A day when people can bring their issue and try to get it sorted out. We're also trying to see how we can set up complaints desks at all these hospitals so that persons who have complaints against staff, against the system, and whatever other complaint, they can make it at that desk. And so these things we can monitor on a weekly basis to ensure that we can correct some of these things. The people have a way, they have somewhere to go to complain.
In conclusion, the chairman stated,
Got 2 rooms in the hospital, try and get 2 vacant rooms, so the doctors can meet with people's relatives to explain to them the condition of their relatives. Because we have had myriad of complaints about doctors not wanting to engage the relatives of people. Abroad they do that. They engage you or your relative to tell them, what is the problem and how you can. They make time, although they're so busy, they make time to engage you or your family, to explain to you what is your condition. So those are some of the things we need to improve on. Of course, some glitches here and there in the health system. I really, I don't want to defend everything just for the sake of defending. But there are issues still within the health system, and we are working every day to ensure that a lot of these issues are being ironed out.
Reporting for Channel 8 News, I am Jalissa Hines.